friends, welcome to Kavita Medicos Education. So today's disease condition is COPD. COPD means chronic obstructive pulmonary disease condition. So it is a long-term disease condition of our lungs where there is blockage happens in the lungs. So the blockage can be partial or complete. There can be partial obstruction or there can be complete obstruction which happens in our respiratory tract, that is called as COPD. So basically COPD happens in the lower respiratory tract. So we all know that we inhale the air through our mouth, through our nose, and sometimes by our mouth also. So this air goes into our pharynx, into the hypopharynx, and then it moves towards the larynx and then to trachea, and then trachea again bifurcate, divide into two branches, that is known as bronchi. Okay, then this bronchi again divide into several small branches which is known as bronchioles, into primary, secondary, tertiary bronchioles. Then comes our terminal bronchioles, then our respiratory bronchiole, then our alveolar duct, and finally through the alveolar duct the alveoli are attached. So this alveoli, this air space, is the smallest unit of our lungs, okay, where actually the gases exchange takes place. Means the CO2 which is dissolved in the blood, it comes into the alveoli, and the oxygen which we have inhaled from the environment, it goes into the blood. This is how the gases exchange take place in the alveoli. So it is the smallest unit of our lung. So what is lower respiratory tract where COPD happens? So lower respiratory tract start from the trachea. Okay, this will start from the trachea, and upper respiratory tract, our nose, mouth, hypopharynx and larynx. Up to the larynx region it is called as upper respiratory tract, and from trachea up to the smallest unit, up to the smallest air space, it is called as lower respiratory tract. So this COPD happens in the lower respiratory tract. So let's discuss with the definition of COPD. So COPD refers to a group of chronic. So it is a group of chronic, means there are some disease condition which comes under the COPD condition. So it is a long-term chronic condition. Okay, it is irreversible, means it cannot be reversed back. The lungs cannot be come back into the same position. The only ultimate treatment is the surgery. Okay, so it is an irreversible condition, which irreversible means the lungs cannot come into the same position. Disease characterized by persistent airway obstruction. There remain a continuous obstruction in the lungs, in the tract, in the respiratory tract. Okay, so there is a persistent airway obstruction from trachea to the smallest airway. So this happens from the trachea to the smallest airway up to the alveoli, resulting in functional disability of the lungs. Due to the obstruction, it could be partial or complete obstruction, our lungs are fully disabled. They cannot do their function properly. There is no gases exchange happen, or there is a difficulty happens in the gases exchange. So the lungs are functionally disabled due to the obstruction. So as we know that there are some disease condition which comes under the category of COPD. So in previous study, we know that there are some 3 or 4 disease condition which comes into the category of COPD. Okay, in older time, in previous studies like asthma, chronic bronchitis, bronchiectasis and emphysema. But nowadays, according to the new research, there are only 2 disease conditions which are categorized under the COPD. That is chronic bronchitis and emphysema. Asthma and bronchiectasis do not come under the COPD because they are themselves are very big disease condition. So we cannot categorize asthma or bronchiectasis under the COPD because they are very big disease condition. So at present there are only 2 disease conditions which are taken under the COPD, that is chronic bronchitis and emphysema. So how you will know that the patient is suffering from chronic bronchitis? What are the diagnosis? How you will diagnose the person from the chronic bronchitis? So if there is chronic and excessive mucus production in tracheobronchial region, so this bronchitis happens in the trachea and the bronchus region only. If the person is having a long-term cough into the, there is a mucus production in the trachea and in the bronchi. little bit mucus remains into our respiratory system, but if there is excessive mucus production in the trachea and the bronchi. So, and again, other diagnosis, what we will do, persistent cough with sputum expectoration for at least 3 months. That thick sputum which is called as phlegm, okay, that thick expectoration phlegm which remains in the patient for more than 3 months. In a year, it will remain up to 3 months, more than 3 months. So this happens up to the 2 consecutive years permanently. So if the patient is complaining that he is having a cough, a thick sputum cough for more than 3 months in a year and for at least 2 consecutive years, it means that person is categorized under the chronic bronchitis. Okay, so this is a diagnosis. Next disease condition that is called as emphysema. So this emphysema happens in our respiratory bronchiole, in our alveolar duct and in our alveoli. So these are smallest branches which are bifurcating into the deep into the lungs. So what will the diagnosis? Permanent dilation of air space from respiratory tract to air space. Respiratory tract, we are talking about respiratory bronchiole. So this is our respiratory bronchiole which is again attached with alveolar duct, and from alveolar duct the alveoli is attached. So if there is dilation in these three, then it is called as emphysema. If there is dilation in the respiratory bronchiole, in the alveolar duct and into the alveoli, then it will be categorized under the emphysema. Next condition, air space weakens and rupture, creating larger air space. If this alveoli is weak, okay, if this alveoli is weak and it is ruptured, then again it also comes under the emphysema condition. So how the mucus is produced, okay, how there is thick mucus is produced in the chronic bronchitis. So we all know that the most important cause, the most important etiology for COPD is smoking. 95% cases of COPD happens due to smoking. There are some other causes present for COPD, but we will discuss them later. Okay, so 95% cases of COPD happens through the smoking. So what actually smoking is doing? Okay, so before discussing the smoking condition, we know that our trachea, our respiratory tract have 4 layers present in it. Okay, suppose this is our bronchi or tract. Okay, so this is our bronchi. It is having 4 layers. So inner layer, the green one, is shown as mucosa layer. Okay, the mucosa layer is composed of columnar epithelial cells through which several cilia are present. So in mucosal layer, there are several cilia present in mucosal layer. Okay, then come the submucosal layer. In submucosal layer, there are several goblet or mucus cell present which secrete the sticky substance that is known as mucus. Then there is muscular there, and the last we have adventitious layer. So there are 4 layers present in the respiratory tract. So why there is cilia present in the submucosal layer? Because if we inhale, if by mistakenly, or there are certain particles present in our environment, so if we are inhaling a dust particle into our respiratory tract, then this mucus will make them wet. Okay, this mucus gland will secrete mucus and it will make the dust particle wet, and through the upward movement of this cilia, this mucus will excrete out into our esophagus and by our mouth, which we call as sputum. Okay, which we call as sputum. So what happens, what basically happens in the smoking condition? If the person is doing persistent or heavy smoker, if the person is heavy smoker, he is doing smoking from a long period of time, then what will happen? A lot of dust particle or nicotine particle will be present into our submucosal, into this lumen, into this free space of our trachea, into this lumen. So what will happen now? Then the cilia will try to excrete, the cilia will try to move out this particle from the trachea, but there are several particles present in the smoking. So the cilia will be degraded, they will become small. Okay, the cilia will be degraded due to the lots of particles, and our body takes a mechanism that is called as anti-mechanism of our body. Okay, so what will happen due to overburden of this dust particle? Our mucus gland, our goblet cell will increase in number. That is called as hyperplasia, and there will also hypertrophy happens in the mucus gland. Okay, so our body will take the action, and this mucus cell will come into the action, and they will become hypertrophied, or there is hyperplasia happens in the goblet cell, and lot of thick sticky mucus again secreted. Okay, this thick sticky mucus is again secreted into our lumen, and due to this sputum, there is a lot of sputum, there is a lot of phlegm. The H1 influenza bacteria will present here. Due to this sputum, H1 influenza bacteria H1 influenza bacteria will attack here. Okay, so there is also a bacterial infection. There is over mucus production into this lumen. Okay, so that is called as our chronic bronchiectasis. Now what happens in emphysema? So in emphysema, again due to the smoking condition, it will degrade this elastic which is present in our alveoli. Actually, our alveoli is an elastic body. There are two proteins which are present into our alveoli. One is called protease, that is also called elastase. Okay, this protease do degradation of protein. Okay, this protease do degradation of protein, and one is called as antiprotease, matlab non-elastic. Okay, this will prevent the degradation of protein. So there are two proteins which are present in the respiratory bronchiole, in the alveolar duct, and into the alveoli. So this is our respiratory bronchiole, this is our alveolar duct, and through this alveolar duct lots of alveoli are attached, and in this respiratory bronchiole, in this alveolar duct, and in this alveoli, there are two proteins present. One is called as protease, other is called antiprotease. So protease is also known as elastic, and antiprotease is also known as non-elastic. So what happens in smoking? That smoking increase this amount degraded protein. Okay, smoking will increase this degraded protein, and this degraded protein will be increased, and this protein will be decreased. So due to the imbalance of this protein, our whole system, our whole tract will be degraded. Our alveolar wall will be degraded, and it will collapse with each other. These alveoli will collapse with each other and form a large air space that is called as bullae. Okay, so due to the degradation of alveoli, they will attach with each other and form a large air space that is called as a bullae. So it is called as emphysema condition. So this is COPD. So next we are going to study the causes and risk factor of COPD. So what are the etiology or causes for the COPD? So number one cause is cigarette smoking, active and passive. So any kind of smoking is harmful for our respiratory tract. So 70% cases of COPD are seen in smoker patient. Active means the person who is directly doing the smoking. Okay, and passive means the people who are surrounding him. They are called as indirect smoker. So the smoking condition, any kind of smoking condition can cause COPD. It is a most prevalent, most important cause for the COPD. Next we have exposure to fumes. So any kind of burning fume means it's a biodegradable fume. Okay, it can be a wood, it can be a coal, it can be a dust particle or dry leaves or a wastage of the household. So any kind of biodegradable waste fume is very harmful for our lungs and can cause COPD. Next we have genetic, alpha-1 antitrypsin deficiency. So genetic means this condition can pass into the other generation. It is a hereditary condition. So what happens in this condition? That our liver secrete a hormone that is called as alpha-1 antitrypsin protein. Okay, this is a protein, this is a protein which is secreted from the liver. So when this protein will be secreted from the liver, it will mixed up into the blood and goes to our respiratory system, which is very useful, which is needed in our respiratory system. Okay, so this protein is important for the respiratory system, but in this condition, what happen? The protein is not secreted by the liver. So there can be COPD condition, and also with the respiratory system, a liver cirrhosis can also happen. Okay, so this is an important protein which is not secreted in the person, and it is a hereditary condition. Next we have air pollution, chemical, occupational. So nowadays the air pollution is increasing day by day. So next we have chemical. Chemicals means the workers who are working in a chemical industries, the fumes which comes from that chemical, like cadmium is very harmful. So next we have occupational, the workers who are working in coal mines, in cotton industry, or in any kind of industry where the small particles form, like coal, dust, bricks industry, and our cotton industry. It all can cause COPD condition. Next we have frequent or severe respiratory infection. If a child or even if an adult is suffering frequently through a respiratory infection or severe form of respiratory infection, then in future he can have COPD condition. Next we have emphysema and chronic bronchitis. So COPD is formed from two main conditions, that is called as chronic bronchitis and emphysema. So these condition leads to COPD in the later stage of life. Next we have asthma with smoke. If person is already having asthma and he is doing smoking, either it is active smoker or passive smoker, then he will have COPD. Next we have 40% above age. Obviously after the older age, after the 40 age, our internal organs or our respiratory system will decline slowly, and it will work slowly, it will function slowly. So in older age, our respiratory tract is not function in a proper way, and we can have chances to get the COPD condition. Next we have dust particles. The dust particles in our surrounding, like it's a sand or it's a dust particle or a pollen grain particles, which can block or obstruct in our respiratory tract. Next we have cold temperature. People who are exposure or who are a long-term exposure to a cold region or cold temperature.